Hello, it's Heather. Just wanted to do a quick video. I am off. This is my third day of not having any class or clinicals or precepting, and I've really been taking advantage of it. Studying as well as just lazing about my house doing nothing, which has been great. Thought I would do a little bit of a video. I don't think I've done one since the semester started. I'm not sure. So our clinicals this semester have been in ICU mainly. Precepting hours are just wherever my preceptor happens to be assigned. The preceptor I see the most is a NICU therapist, so she does floors as well as NICU because at the hospital she's at, the NICU isn't enough to warrant just having the NICU. So I've gotten some good time in the NICU. Unfortunately now they've said that we can't go in the NICU anymore as students, not just us, but nursing students and everyone else apparently. No students of any sort are allowed in the NICU because a nursing student tested positive for COVID, and so then the person in charge of the NICU got worried that other students might bring it in too. I don't know how students are going to bring it in any more likely than the rest of the staff, but whatever, I'll follow the rules. So precepting has been going well, clinicals have been going well. I've been at a new location for clinicals that I hadn't been to before, a much bigger hospital, much more trauma, a lot more just patients, a lot more stuff in general. And at that hospital, things are very different as far as what respiratory therapists do. At that hospital, respiratory therapists do no neb treatments. They don't do ABGs. They do vents. They care for vents. I think they do some trach care on some of the floors. They don't do an awful lot of floor work as far as I know. It's mainly ICU, taking care of vent patients of various persuasions, heart and ARDS and COVID and all of that. So that's been really interesting just to see a new environment. I like that hospital fine. It's huge. I don't think I would find my way around for like 6 months. I would still get lost constantly, I'm sure, because it is just so big. But that's been really good. I've had a really, really great couple of clinical instructors there who are excellent teachers and have taken the time to go over a lot of information with us. We haven't seen as many patients. We haven't done as much patient care, but that's been made up for by looking more intensively at the patients that we have seen. So that's been really good. I am about 8 months away from graduation at this point, and it's really feeling a lot closer than it did at the beginning of summer. And luckily, I am starting to feel more confident in what I know and my skills, and feeling like I can say, hey, I think this patient might benefit from this, or why are we giving this treatment or this, medication or whatever. Some things that I feel like I'm weak in are is pharmacology in general. We had the one pharmacology class in my school, and I got an A in it. I understood everything at the time, and I've just lost some of that, like remembering what it is that a SABA does. What is it that a LAMA does? How do they work? How do they act on the body? Which ones are which? So I am making myself go back over a lot of my pharmacology stuff because I just feel really weak in that area for just the general medications that are used. What is Atrovent and what does it do exactly, and things of that nature. So I'm going over pharmacology more. I am still definitely trying to get down some of my general normal values and critical care values. I have taken 2 TMC practice exams at this point. I took the one that is in the back of the Persing book that I have. It's Respiratory Care Exam Review by Gary Persing. So I took the TMC exam that's in the back of that book. Excuse me. And it was 160 questions it said in order to get a passing score for the TMC on that, you have to get 120 correct. And I got 116. So I technically did not get a passing score on that one, but it's also scored differently than the actual TMC is. So then this morning I went ahead and took the TMC practice exam off of the NBRC website. And I got 111 out of 140 on that, which is like a 79%, which in my mind sounds really, really low, but I believe from what I've been told by other people that would have actually been a score that would have passed the high cut mark in order to then continue on and take the ClinSims. So if that's the case, I'm encouraged by that. I mean, it's not the score that I'm used to getting, but if it's a score that would get me to be able to take my ClinSims, then I'm really happy with that, especially considering that I still do have 8 months until graduation and that much more time to get that information. You know, I really did not know anything about the neopeds questions. I kind of have a little bit of an inkling because I still have been studying my normal values for NICU. But I just started my neopeds class this last week. So a lot of the neopeds stuff that was on the test, I was not prepared to answer. So I figure once I get done with my neopeds class and once we go into PFTs, pulmonary function tests, which we were supposed to do this semester, but because of COVID, none of the hospitals we go to will allow us to be part of the PFT stuff. So that's been put off a semester by our program. So I think once I do neopeds and the PFTs, I will have a much better, I will have an ability to get a higher score on the TMC than I did. So I feel like I'm in a good position at this point. Still a lot of studying to do, still a lot of work to do, but I'm getting there. Big things at this point: studying normal values, making sure that you know all of your general normal values and your critical care values and all of that just down cold without having to sit there and think about, you know, what is pulmonary capillary wedge pressure, what's pulmonary artery pressure, and you know, those are still some that I struggle a lot with, is the hemodynamics. We've been going over that a fair amount in one of my classes this semester, and I'm grateful for that review because I did not have that stuck in my head the first time around. So I'm working on doing more of that now. I still don't have it all down pat, but I will. I think that's pretty much it for now. I was thinking of doing a video talking about codes, going to codes, and you know what it's like to be part of a code where a patient dies, be part of a code where, you know, families there, where you're doing a terminal extubation, things like that. So if that would be of any interest to anyone, let me know. And I think that's it for now. Sorry if it's a little bit shaky or if my hand was getting in the way from the steering wheel and having to honk at people, but you know, they cut in front of me, so I had to. All right, hope everyone's doing really well. If you have just started your program, let me know how you're doing. If you are a fellow second-year student, I would love to hear how you're feeling about board exams coming up in the spring, and hope everyone's doing well. See you later.